Everyone, welcome back to another session of A Day with your fertility specialist. I'm Joanna Damina, your host for today. I'm building off of where we started on Wednesday. We're talking still about laser vaginal rejuvenation, but we're going beyond just intimacy and sexual satisfaction. We're looking at some medical benefits. Yes, I know it was touched on the last time, but if you're joining us again today, we might actually expand on that a lot more. If you're joining us for the first time, welcome. And if you're joining us again, thank you so much for being here. We really do appreciate your comments, your likes, your shares. And on that topic, please share this with someone that you think will be interested in this topic, someone that has mentioned this in passing, or anybody that you think would benefits from the knowledge that I shared on this live session. So today we have Dr. Ken joining us again. Hello, sir. Welcome. Always lovely to have you here. So you already started talking about laser vaginal rejuvenation, and it's a very interesting topic. Yeah, if you follow us on social media, you've probably seen one or two videos about it, shorts and reels, wherever it is you're watching from. But today is an in-depth, kind of thing. That's what our live sessions are for. They are more in-depth conversations about topics that really are, things that you should be aware of and help you in your decision making and your health in general. So yes, I know we've spoken a lot about laser vaginal rejuvenation in the beginning, but we want to really get into the medical benefits or focus more on the medical benefits. People associate this procedure with a more cosmetic goal, like increased sexual satisfaction most of the time anyway. They hear rejuvenation, you're thinking tightening and having better intercourse. But what are some legitimate, medical indications as to why someone might need to have laser vaginal rejuvenation?
Yeah, thank you, Joanne. Though we talked about it briefly
Yeah,
in our previous sessions, but maybe we'll look at it a bit closer.
exactly.
So now in gynecology, for instance, there is an entity called uterovaginal prolapse.
Okay.
You have three anatomical components of this. It's either the uterus is falling down through the vagina, and then it gets so bad sometimes that the entire uterus, which is the womb, comes down through the vagina.
Wow.
That's almost a total prolapse.
Yeah.
But then you have the early stages, where it's just a mild descent. Then you have a problem with the anterior, the front part of the vagina.
Okay.
The part towards anterior. I don't know what word to use there.
In front.
Where the bladder rests on the vagina.
Okay. Yeah.
Anatomically, the bladder rests on the front part of the vagina. Then the rectum, the anus, rests at the back side of the vagina. So when a woman is aging, or when she has a lot of trauma to the pelvic floor, some part of the bladder can push its way into the vagina.
Oh wow.
Exactly.
Yeah.
Some part of the bladder can push its way into the vagina. Then some part of the rectum or anus can push its way into the vagina too, from the back.
Yeah.
The bladder coming from the front, the rectum coming from. By the way, rectum is the storehouse of feces, of stool, poo. You understand? It gathers there and gets out of the body. So now it pushes a little into the vagina. Then you could have the uterus itself coming from the top, going down in the vagina. And when that begins to happen, a woman have problem with the urination. She may have increased frequency of urinary tract infection because urine outflow will be with hesitancy, and then she may have problem with defecation, mild or in different degrees. And so early stages of these abnormalities can be corrected with laser vaginal rejuvenation without having surgeries.
Yeah.
Without having surgeries, because the real cause is weakness of the pelvic floor muscles, and then it gives room for all of those structures to begin to push down through the vagina. So laser vaginal rejuvenation can actually cause a toning of the muscle,
Yeah.
tightening of the muscles, and then pushing back the structures into their real anatomical position.
That's interesting.
And so there is improvement in urination and defecation and even the sexual health. So it's not just the sexual health. Now you see, you're taking care of urinary problems and defecation problem and improving the health of the vagina itself. Okay, sometimes you have a single entity called stress urinary incontinence, where you just have abnormality with the urethra. The urethra is a structure that allows the flow of urine from the bladder of the woman through the vagina outward. It's just on the upper part of the vagina. Sometimes it has anatomical abnormality because of the weakness of the muscle of the pelvic floor. So laser vaginal rejuvenation
can actually
helps with that, because this is common with women that are aging. For instance, they want to cough and then you see urine just leaking, or they're laughing and you have urine leaking. Whatever cause intra-abdominal pressure to just increase causes them to leak urine, and they may not be in a good place to just go have some convenience. So those unnecessary leakages of urine can actually also be fixed with laser vaginal rejuvenation.
Really
so
nice.
These are health benefits that relate to urination, defecation, and then can improve sexual intercourse. But while all this is going on, you have benefit with increased thickness of the inner lining of the vagina. And makes it a bit tougher to stand pressure of intercourse, bruises with intercourse. It takes care of all of that. Then, of course, the glands that makes lubrication in the vagina easy, prevent friction, unnecessary friction during intercourse, bruise and tears during intercourse are also improved. So yeah, you see,
there's a lot.
The benefits are actually quite a lot. This is all without surgical intervention.
I was going to say that, if you didn't join us the last time, Dr. Ken actually brought the probe on here, the laser that is used here at Alps Hospital. So you can always go back and watch our videos. They're all there on YouTube and on Facebook. You can go back and see that. I think you'll be interested to see what this thing that he's talking about and how it accomplishes all of this. I mean, I'm sure you never would have thought your defecation has anything to do with the vagina. Some people just think they are totally separate entities like that. But this is really interesting.
Another part that interests me is this very complicated case, the VVF, vesical vagina fistula. The pelvic surgeons operate these a lot when a woman has a difficult labor, and then there's some ischemia or necrosis of the structures around the bladder and vagina, and so it allows for leakage of urine, because the structures, the muscles, mucosa are devitalized. So now the gynecological surgeon separates these structures and repairs them. But no matter the repairs, these structures are usually devitalized, and sometimes you have to even take some graft from some places to superimpose around those areas, so you cause a good healing. So despite that, rehabilitation is usually a problem. But laser vaginal rejuvenation actually would help a lot with this. And I think the pelvic surgeons, gynecological pelvic surgeons, are actually considering from recent conferences and publications that they have.
It would be really good.
They've made observations that this vaginal rejuvenation, whether use of PRP or laser now, can be helpful in rehabilitating women who have had vesicovaginal fistula. Yeah.
I mean, that sounds, a lot less traumatizing than the surgical procedures that they will most likely have to go through otherwise. And it would be really interesting to see how that actually works and helps them in future. So I know you touched on menopausal and perimenopausal women and vaginal dryness and sensitivity and discomfort. So how does laser vaginal rejuvenation actually helps these women when they get to that level?
Okay, see, when women are getting towards those perimenopausal, menopausal stages in life, estrogen is low, the vaginal dryness becomes a big problem. Then frequency of infection may be high, painful intercourse because of atrophy of the mucosa of the vagina. All of this just happen. But you see, when you apply laser to the vagina, for instance, it helps in the position of formation of collagen. Now, collagen is one important structure that our skin have. That makes our skin a bit tough and makes it turgid and good to touch. You have a lot of collagen in the vagina of young women, but it decreases or depreciates as they're aging. So laser help in deposition of formation of collagen.
Wow.
Exactly.
Can I get like laser on my body when I grow older?
Laser can be used actually anywhere. It's used in the joints, for instance, on the joint for those that have joints, maybe surgeries to help the rehabilitation of the joint, helps in control of pain. It helps even with the skin and all of that. So it does a whole lot of things. So we're just looking at laser now for just gynecological purposes. So it does that. So it helps in formation of new blood vessels. We call that new vascularization in physiology or anatomy in medicine. You understand? So it helps formation of new blood vessels, deposition of collagen around the areas of interest, reticulin, which are all the fibers that help muscles to be tensed, tough, and turgid. It helps all of that, and it helps the glands in the vagina to begin to produce lubricants that will help all of that. So now you see, you have new blood vessels, reticulin deposits, glandular secretions. So vagina is young again.
It's just revitalizing.
Exactly. So that is the rejuvenation now, in addition to the tightening that it calls for those who feel that they are, of course, when the muscles of the pelvic floor is weak, the vagina becomes lax. It lost its roughness, it loses it. So with rejuvenation, some of all this begin to return. And then the woman needs to have sessions and sessions from time to time to
I was going
help.
to ask that, like, is it just a one-time thing, or you do have to do it multiple times? How does that work?
So now she would be under the care of a gynecologist who will decide what number of how many sessions she needs.
So it differs.
For those who are getting towards menopause or who are menopausal with all the signs that we're talking about, for the first treatment or therapy, they need 3 sessions. 1 session per month for the first 3 months. Then 1 session yearly. You understand? 1 session yearly. And for me, I think that's just okay.
That's very
that is just quite okay. 1 session yearly.
I mean, thinking of all the benefits that come with that, you just get it out of the way the first 3 months, and then you just have to do just
so, but if you're doing a rehabilitation following a vaginal delivery, for instance, it's just 1 session. Or just 1 session, because you're dealing with younger population of people.
It does sound like a miracle.
Exactly, just 1 session. Because for them, it just damage to the muscles that may probably have occurred during vaginal deliveries, But of course, if she needs more than 1 session, depending on the degree of the damage she has, the doctor will decide all of that. And all the accessory exercises that may go with it, like the Kegels exercises, and all of that. So that'll be fine. So it depends. Recommendation depends on the degree of abnormalities you're dealing with.
Okay. Well, that's nice. I mean, for the after childbirth, you're thinking of just one session. I think that is still, honestly, if you just have that one thing. And I know a lot of women are quite uncomfortable after childbirth, and you don't really feel like yourself anymore. It's nothing to be ashamed about. I mean, there are things that are in place to actually help you become a more confident version.
You know, most first timers at deliveries get a cut or get a tear. You know, get a cut, get a tear. You know, and this cut just get the place expanded, so the baby could come out or be pushed out. You know, and then you fix the cut. You know, so they need all of this because it helps with healing of the muscles that may have had micro traumas to them, and even the cut. It helps in healing of the scars and making the scar finer. You understand? So first timers often get this cut, you know, and then even if you're not first timer and it comes out easily, the baby comes out easily, it means already the place has been damaged. It's lax already.
I can imagine. So that's already something.
So they need it even more than the first timers. You know, so that's just it. But you know, it's because of all of these challenges with sexual intercourse that the rate of cesarean section is higher among a particular sect of people in the society. You know, when we're doing residency, some few years ago though, when I was a resident doctor, we observed that cesarean section is very high. The rate is high in Brazil. You know, very high in Brazil compared to some other parts of the country of the globe. And it's because they are preserving the vagina. So the vagina is actually quite important. It doesn't matter what we say here. It may just be uncomfortable saying it, or people find it difficult to just own up to it or talk about it because of societal perspective or view about the word vagina. But I'm a trained gynecologist. I mean, you use practically it every day.
Most likely.
And I wish I don't have to be dealing with that, but that's just my job, you know. So if I mention few number of times vagina in it, maybe 40 times.
Wow.
So I think it's my most popular vocabulary.
I think you probably use it up to that 40 times on this live alone.
So it's my the gynecologist's most popular vocabulary is the vagina. To be very candid with you, I think so. I really think so. Because that's our own access into the woman's body.
Exactly.
You know, access to the woman's body. We're operating, you have something to do with the vagina. You're operating in the abdomen, on the pelvic, you have something to do with the vagina. You examine, you have something to do with scanning, you have something to do. You're doing hysteroscopy, you have something to do. You're putting embryos into the uterus, you have something to do with the vagina. So everything.
It at least just got literally everything.
So
those are some of the things that, you know, a person might actually want to know when preparing for a
So you see, this society restricts vaginal delivery. You know, among some socialites, social class, you know, because they want to spare that aspect of the body, so it can be young for a very long time.
It's really funny. Like some people have that wanting to spare the vagina, and then others want to be the Hebrew woman. They don't want any CS at all. It has to be vaginal.
I used to tell them that when the Bible talk about Hebrew women, the current the conventional or contemporary woman doesn't understand what it means to be a Hebrew woman. You know, who are those Hebrew women actually? They were farmers. They were plantation workers. They mowed blocks for building of all the things they went through in Egypt. So they were physical women.
Yes, very active.
Physical women. Probably eat in the farm, sleep in the farm, under punishment, under observation. And their mindset as military mindsets, nobody to console or pet them. They were under, when we kids, we used to watch Egyptian movies, and those Egyptian soldiers are very ferocious. You can imagine when you're dealing with that kind of people, you must deliver by the So they had nobody to pet them. And then their diets are to a large extent natural diet. Today, the world is different. Today, you know? So those are who Egyptian, the Hebrew women, they were physical women, nothing spiritual about them. You know, of course, God was on their side according to the Bible. You know, so they were Hebrew women. So today you see women say they don't want to have cesarean section because they want to claim their Hebrew men when they eat pizza, meat pie, ice cream, donuts,
Probably haven't had any vegetables
and they
like
don't even
in a week
exercise.
or
They don't
something.
even exercise,
Yeah, and
and
exercise is really
and
good for hip
and they think
mobility
about
and
Hebrew
all
woman.
of that.
So
But
they claim it, but they don't work
yeah,
it.
I mean, society is a very interesting place. You always have one or the other. It's like,
Some fear,
yes,
some don't
some
even want
people
to hear
want
the
to
word
hear it.
CS.
Mhm.
Now,
Okay, but for vaginal rejuvenation, we've spoken about people that are candidates for it. Let me say, that it would be a good thing for them to have. But are there people who should avoid it? Yeah.
oh well, really, I don't know who should avoid it.
I mean, it does sound all around very
If a woman
beneficial.
has a condition that warrants it or that necessitates it, she should have it.
Yeah.
Yeah, because who should avoid it? I don't know who should avoid it. Except, of course, there is a problem in the vagina, maybe that doesn't permit contact or touch.
Yeah.
Then of course you can avoid it.
Okay. That's fair enough. So basically, it's like it has so many pros and literally just a half of a con. The con is only
Oh
that
yeah,
just in case you
just in case,
have
yeah.
any prior medical history or anything that would
But you
require you not
see,
to do that.
women are so tough that sometimes they want to have surgeries to fix the vagina. They go. I mean, we do all those surgeries, where we reduce the capacity of the vagina and makes it tighter.
Yeah.
Surgery for 1 hour, 2 hours under anesthesia. And then you're through with the surgery and you take the next 3 months to get yourself back, and then before you resume sexual intercourse. And even with the sexual intercourse, you have to use lubricants, because it still doesn't make it look
So it
normal.
doesn't
Okay.
really improve all
Oh
those
yeah.
things like collagen
No,
and
no, no,
then
no,
the
no, no,
gland
no,
production.
no,
It
no, no, no,
just
no.
reduces the
Exactly.
capacity of
So
the
with the
vagina.
surgery, you can only get tighter, but the pain may still be there. The dryness may still be there. The thickness or the mucosa of the vagina will still be there.
Yeah.
But these are all the things that vaginal rejuvenation with laser does. It takes care of all of these and still makes it tight.
Oh wow.
So even if you have surgery, for instance,
You might
you will still need laser
laser.
rejuvenation because there are other benefits that laser brings that surgery doesn't. Surgery is just mechanical, anatomical restoration,
Yeah.
while laser is both anatomical and physiological. Physiological is a function. It restores the function of the vagina largely.
It's nice. But like with your clients, I would say, or with your patients in general, I know I keep saying this, it's nothing to be ashamed of and it could actually help you with your overall confidence. But have you actually noticed this with your own clients? Like they feel more confident or they just, feel generally better about themselves after having vaginal rejuvenations and having these symptoms reduced?
Yeah, what you hear from some of them, it's they feel a lot better.
Yeah.
And they can't wait to have their next session.
Oh, wow.
So that tells you what the general feeling is. But on one or two occasions, you get some degree of dissatisfaction.
Okay.
And you need to look closely and see.
There might be other factors.
Yeah,
Involved.
dealing with.
Okay.
And when women are getting towards menopause, their problem goes deeper than vagina. A lot of psychological or emotional problems associated with, and that can cloud the judgment for some people on what benefit they get from this kind of intervention.
Okay.
So we can't really rule that out.
Okay. So we have a comment from Chiamaka Hope on Facebook. Thank you for joining us. It's your first time. Oh, that's nice. So I hope you stick around with us and we're kind of thrusting you into the middle of vaginal talk your very first time. But it's okay. Thank you for joining. She asked the question. I'm not sure if this is just a general question you want to ask Dr. Ken or if it's related to vaginal rejuvenation, but she says, can you operate one with uterine fibroids? So I don't know if this is if you can do the rejuvenation with fibroids or if
There are two different things. Rejuvenation is the vagina, the fibroids in the uterus.
Okay.
So yeah, as a gynecologist, part of what we do for fibroid surgeries, it could be a myomectomy open surgery. It could be, depending on the location, it could be hysteroscopic surgery where we go through the vagina into the uterine cervix, into the uterine cavity. Then it could be laparoscopy. So whichever condition it is, I think we're able to take it.
Okay.
Yeah.
Well, I hope that answers your question. And, this is, as always, I'm ready to give a shameless plug. Please come in here. You can book consultations online if you're not in Jos or Abuja. You can talk to us online. If you're in Jos or Abuja, you can come visit us. Our addresses are on the screen. Our numbers are there. There's a QR code for you to scan. Everything is there for you. We just need you to take that first step. Trust me, you're in safe hands. You're in really good hands with our specialists here. But, outside of just, I don't want to really like shade clinics and all this, a lot of aesthetic clinics are coming up there. But what would you say is the importance of having this done in a qualified medical, like a hospital, instead of having a rejuvenation done in a clinic? Are there differences you would say?
Well, in as much as I know that rejuvenation is not a surgical procedure, so it can be done in a consulting room. Yeah, under the guide of a chaperone if a gynecologist is a male doing it. But in our facilities, I think the nurses do it because woman to woman, it's a comfortable situation. The gynecologist may just be around the corner just in case there's a technical issue that needs to be sorted. And the laser technicians, sets the gadgets, the right wavelengths, and the amount of laser energy to be dissipated, the amplitude, the frequency, all of that is set. So the nurse just goes, does the work, do the work for the next 10 to 15 minutes. So wherever you choose, it's choosing. I mean, for this procedure to be done, should be just decent enough for a woman to be comfortable. What I don't subscribe to is the fact that I know that there's a local vaginal tightening procedures that women do outside in the society or in the community, where they make them sit in hot concoction.
Those things like only
exactly. So the water can, the heat can burn, and we've seen some of them coming down with lot of burns in the vagina, and sometimes these burns produce a lot of scar tissues that can complicate life, including causing infertility and difficult with intercourse. That requires series of surgical interventions to even correct.
Trying to.
So those, I think, people should carefully access those kind of care. But so long as it's going to be done in the clinic or in the operating room, in whatever decent environment in an organized orthodox hospital setting, and the person handling is qualified, I think it's fine.
Okay, that's good to know. I mean, a lot of times, you just have someone just open up somewhere and then there's something going on and you're not sure. So do your research. Basically, you should be able to confident in where it is that you're going to and accessing all these treatments. So we have another question. This is not related to laser vaginal rejuvenation, but let me just chip this in here because Chiamaka is very active today and we really do appreciate that. So we would like to answer before we round up. But she said she'd like to ask, can one with unicornuate tube that has multiple fibroids go for surgery? Is it safe?
It is safe, yeah.
Okay. Okay. So
that's interesting. Unicornuate.
Yeah.
It's a uterine abnormality, where the uterus has only one horn. The uterus has from formation has a two parts that join to form a single uterus. So when you have the one of the part lacking in the formation, you have a unicornuate uterus. Okay, so it's like half of a uterus.
Yeah.
And then some people conceive with that half of a uterus.
Oh, wow.
Yes. Some people have two horns of the uterus that are not well joined, well formed, and then pregnancy happens in one.
Yeah, so you see, like there's a division,
exactly,
kind of division in the uterus,
exactly.
And, then, wow.
And either of this division can have a fibroid. And so if the fibroid is posing symptoms or causing problems, of course, it should be taken out, and it won't pose any problems. And in that process, if it is a biconduit, for instance, it can be repaired. It can be repaired. Yes, it just depends. It can be repaired, and sometimes laser helps. Because I know we have repaired, we've done a lot of, we call it metroplasty, okay? We've done a lot of abnormal uterine, congenital uterine anomaly repair using the laser.
Oh, wow.
So forget the part we're just talking about laser vaginal rejuvenation.
Yeah,
Laser
there's other importance
is just versatile in a lot of surgeries.
Yeah.
And it works seamlessly for some kind of procedures, which are more advanced than laser vaginal rejuvenation. Yeah.
I mean, laser sounds like it just sounds very interesting to be around. Like it has so many importances, so many uses, and it's so
Exactly.
versatile. It's really
Exactly.
interesting.
Yeah.
It's really nice. So yes, I mean, this is basically part 2 of the laser vaginal rejuvenation talk, and we've spoken a lot about it on Wednesday. The first one, like I said, if you didn't join us for that, you can always go catch up on it and watch that. So I'm just going to be throwing the floor to Dr. Ken. If there's anything else, I may not have mentioned or not as asked, and you haven't asked, but he might think about or know about and want to share with us about the whole laser vaginal rejuvenation, its benefits, and how important it is, basically.
Well, I really don't have anything extra to add, except I have a question to answer to attend to. Yeah, but all I say is that it's about time women begin to take every aspect of their life serious, and you don't need to suffer in silence. Give yourself the best treat. The laser vaginal rejuvenation is not just for intercourse. Intercourse is just one of the benefits. The vagina is an important part of the human body, and it needs to be taken care of. Just the way we take care of our foot, our feet, our fingers, or whatever it is, manicure, pedicure, all the things we do, and even hair.
So
vagina
basically,
needs to be taken care of.
vaginal rejuvenation is a spa day for your vagina.
I think we really need to be taken care of, because, well, being a doctor for women, I know what they go through.
Yeah.
And sometimes we know what they go through more than their partners. Yeah, because if I tell you all the barrage of things we listen to during consultation as gynecologists, you just be wondering what exactly it is that this world of gynecology is all about. So I think women should prioritize that, because even infections that are very difficult to treat, recurrent vaginal infections, find solution with laser vaginal rejuvenation. Can you just imagine? So it's just what it is.
Wow.
Yeah. So women should take advantage of whatever advancement in vaginal care there is, and give themselves a treat.
Yeah. Okay. Well, like you said, it is a treat. It sounds like it.
And to me, an aspect that I would have loved is to see women who have vaginal deliveries, have a session at least of laser vaginal rejuvenation. Because whatever you think or whoever you are as a woman, so long as a baby comes out of that vagina is traumatized.
Yeah.
How do I know? That is why they shout when they don't have anesthesia. It's painful. It tears
is.
them apart.
Yeah.
Or it tears the muscle, no matter how small. And the place they sore for a while before it gets back.
Yeah.
And they never get back for some people. Some people are lucky, they just get back, but you have some injuries.
Yeah.
And it's the cumulative injuries that makes the uterovaginal prolapse happens when they are advancing in age. So if you have a laser vaginal rejuvenation after vaginal delivery, which is what is currently being recommended, we will deal less with uterovaginal prolapse later in an advanced life.
Okay, so not only is it actually beneficial for you now, it's also beneficial for
exactly,
you in the
because
future.
it prevents problems for later. Prevent later problems. Yeah, so it's just what it is.
Yeah.
So I know there are a lot of women giving birth. Let's assume they're not doing it for intercourse. After birth, the first 6 weeks of puerperium, have a go on one session, and then see what the result will be like.
Yeah.
Yeah.
Especially if you've had a child before. I actually am quite interested. If you've had a child before, you've never had vaginal rejuvenation or laser vaginal rejuvenation, and you're about to have another child, and you're watching, and you come to Abs Hospital, you might want to think of it or consider it. I would
Mm.
actually be very interested to know how the difference is in real
You know,
life.
locally, when women in this part of the world get pregnant and deliver, and their old mothers or aunts
Yeah.
come to visit, they give them some massage. You understand?
Mm-hmm.
They make them eat all kinds of things,
Yeah.
massage the abdomen, and trying to see they're taking the abdomen back to the
How it
original
was.
shape.
Yeah.
Let's assume that is abdominal rejuvenation.
That would be a new sex.
The place that suffers was not rejuvenated,
Yeah.
which is the vagina.
Mm-hmm.
So I think that should be really considered and be put in the front. I mean,
Yeah.
front burner,
Yeah.
and should really consider doing that. Yeah, should really consider doing that. If I have my way, every woman who has vaginal delivery, I will advise her to have one. Yeah, but because it is a luxury and aesthetic service, you can't make it compulsory for everybody.
Exactly.
But whoever likes whoever likes herself should consider that.
Okay.
Mm-hmm.
So thank you so much,
Yeah.
Dr. Ken. Like I said, it's always very nice having you on here. Thank you for taking your time to break these things down for us. Women, it really is a treat out there for you to think of laser vaginal rejuvenation in the now and even in the future. Like you said, there are some things that can be prevented when you have a vaginal rejuvenation earlier on in your years. And I just think this is a very interesting topic. I mean, okay, so just a conversion.
There's testicular rejuvenation.
Okay.
And I'm serious about that.
Okay, I'm sure we're going to
But
get
we're not
into
talking
that.
about that.
Yes, but
and I don't
that's a
want to be
topic.
the one to talk about that. You should
Oh,
get
why?
a urologist to talk about that. But to be very candid, there is testicular rejuvenation. And then you keep hearing women talking about enlargement of the penis.
Yeah.
You understand? So if the penis is going to be enlarged, why don't you rejuvenate the vagina? Well.
Food for thoughts, or I don't know. But yeah, you probably heard the word vagina a lot. I mean, someone came up to me and if you've seen my face before, it's on our Instagram page, and I spoke about vaginal rejuvenation, and they said, "Oh, I don't have anything else to talk about. It's vagina and I'm talking about." And I'm just like, well, it's quite important. It really is, as funny as it sounds. It's very important. It's an important marker of your health and who you are as a woman, right? And if you can do something to make you feel better, more confident, you have less complications, less infections, less chances of that prolapse, less problems with incontinence, urinary incontinence, and everything else. Really, it's just a full package that helps you deal with so much. So if you're dealing with one thing or another, or two or three of the things that we've mentioned, talking about laser vaginal rejuvenation, you might want to actually come in and see how that's going to benefit you. So thank you so much for joining us today. It was very interesting. If you stuck with us, then I know that you also found this interesting. So please join us every Wednesday and Friday by 3 p.m. on Instagram, Facebook. Sometimes we're on TikTok like today, and then there's also YouTube. So you can always join us everywhere. Follow us, turn on your post notifications in case you forget, so you can be reminded. Thank you so much for joining us today. Sorry about the delay in the beginning, but we really do love that you are here. Before we go, I want to give another shout out to Chabaka, because Chabaka has been, there, and she says she loves us so much for answering her questions. That's what we're here for, and we really hope that we can help you even more in the future. So have a lovely day. Goodbye.